In addition to the examination of blood smears, the modified Knott techniques can also be performed for the differential diagnosis of microfilaria of Dirofilaria immitis and Dipetalonema reconditum. For performing the modified Knott techniques, take 1 ml of blood with 9 ml of 2% formalin. Afterwards, centrifuge it at 1500 rpm for 5 minutes. Discard the supernatant and examine the sediment after staining with 0.1% methylene blue. In positive cases, the microfilaria of Dirofilaria appeared as slightly curved body with tapered anterior and straight posterior end. On the other hand, the microfilaria of Dipetalonema has a straight body with blunt anterior end with a button hook-like posterior end.